Good morning.
Good morning. How are you all?
Doing good.
Morning.
Oh, I so love that you have ASL interpreters on. It makes me so happy. Thank
Yes,
you for doing that.
of course. I'm gonna do some setting adjustment here so we can be sure to see them as well.
Do you happen to have an agenda you could email us, Caitlin?
Yes,
Okay, we'll put our email addresses in.
I'll go ahead and just drop it in the chat.
Yeah.
And Hope, do you need anything? Or sorry, not Hope. Megan, do you need anything for to get ready for today?
I don't think so. You sent me the agenda and the roster, so not that I've looked at it yet. I just got off a DC meeting for the disaster relief
Oh
supplemental.
yeah. I know
So
I'm
that's
from Tennessee, and a lot of our friends back home have gotten flooded out, and a bunch of people are doing crisis relief back home right now. So very thankful for that.
tragic, and I hope it's okay that that email I sent to Tracy just had a question around SAMHSA's, involvement on making sure everyone has their mental health needs taken care of too, because it's scary. And
Mhm.
sometimes people are like, here's some toilet paper, but you're like, I really need to talk to someone about how sad I feel.
Yes, I completely understand and agree with that because it's a lot. It's definitely a lot right now.
Are your family members okay?
Yeah, I have an aunt in Florida who got hit really hard, and then a couple of my friends' houses flooded out in North Carolina because I'm like right on the border of North Carolina where I'm from in Tennessee. So there's been definitely a lot happening, but everybody that I know is safe, and that's the biggest thing for right now, and it's the process of rebuilding and regrouping and things like that. But thank you very much for asking. I appreciate it.
Yeah, we're hoping they can co-locate mental health services with food banks. So when people are getting food bank resources, they also are able to access some mental health supports, and for the first responders as well, because I think that that's important too. So yeah.
I'm just
Anything
gonna
you
get
need?
off for 1 second. I have to adjust something here. I'll be
No
back in.
problem. Thank you.
Anything you need from me today, Caitlin, for chairing the meeting?
I do not believe so. Our SAMHSA TA, Ann Denton, our TA request finally got approved by SAMHSA. We just got that notification this week. And so I had my first meeting with her to go over kind of like next steps and everything yesterday. And when we're looking at that council subcommittee audit, I'm going to ask her to kind of speak to that because she was telling us, some of the other council subcommittees, excuse me, that some of the other councils are doing in various states. And it sounds like we could really condense what we have right now and kind of utilize what some of the other states have come up with in their own creative way. So I'll ask her to speak about that. But other than that, I don't think so.
Perfect. That's great. As long as we're continuing to capture the voice of the people. And for the roster, just tell me about that. Is that
So when you click on that Excel sheet, are you in the Excel sheet?
yes, I have too many tabs, Caitlin. I'm outing myself on the meeting.
You're fine. Story of my
Um,
life.
the one that if it's crossed out, it's
So
is
if
there
you
a
go to if you look at the bottom of your screen on that Excel sheet, you see the
oh
fiscal year 24-25 roster. Click
yes.
on that one, and that is our
Okay.
updated list for now.
Thank you.
You're
I
welcome.
appreciate that. And um Yeah, sorry I had to share with everyone how many tabs I have. It's embarrassing.
Multi-tabs are the sign of a brilliant mind.
Oh, thank you. I appreciate that. Sometimes it feels like a beautiful mind when you look at my self-organization.
Hello, Miss Savannah.
Could you please drop the agenda again because I left and I came back and now it's gone in the chat.
Go. I will just drop it for everybody as well.
Thank
Good
you.
morning, everybody.
Good morning, everyone. Thanks for joining. We're going to give it just a few minutes for the rest of our amazing crew to join us.
Good morning, everybody. How are you all?
Good morning, Caitlin.
Doing some back-end stuff really fast, making sure that we are all good to go here. Give it a couple more minutes for everybody to start logging in and joining. Good morning, everybody. Right. Just give it a couple more minutes to let everybody join and get settled in.
Good morning, everyone. Just waiting maybe another minute or two for the rest of our team to join.
You know, a lot of people join in. I get the ding dong. Good morning, everybody. All right. Well, it looks like we have a good group of people on today, which is so exciting because we have some new members, which we're super excited to introduce today. So what I am going to do is go ahead and share my screen so we can all see the agenda. I'm also going to drop the agenda in the chat for you all again as we start today. And then I am going to pass it over to your vice chair this morning, your very own Megan Lovelace. Just give me just a second. Let me get everything up and running. I have too many, as you said, Megan, I had too many tabs open today. And
Tabs are a
luckily I
sign
have
of
multiple
brilliant.
screens, but I don't know.
So welcome everyone. My name is Megan Lovelace and I co-chair this wonderful Council of Amazing Minds. And I am going to go ahead and call this meeting to order. And welcome to our new members. We're going to get going with our roll call here. And Caitlin, will you take notes on that?
Absolutely. And just make sure, can everybody see my screen? Seeing some thumbs up? Perfect. All right. Let me know if I need to zoom in on it anymore as well.
All right. And again, welcome to our new members. If I do mispronounce your name, please correct me. Also, please come off mute and state the word present because there's no time like the present. Okay. Aaron Black. Aaron Black. Natalie Brown.
Good morning, present.
Savannah Brown.
Present.
Charles Davis. Carrie Eckert. Jacob Fry. Sean Gartell. Kelly George.
Good morning, present.
Laureen Gilroy.
Present.
Marjorie Grimsley.
Present.
Jenny, help me out here because I want to say it right.
Gentiva.
Genchiva.
I'm present. Good
Thank
morning.
you. Good morning. Danielle House.
Present.
Hope Hyatt. Don't think Hope could be here today to be pressing issues with work. Stephanie Johnson.
Present.
Megan Lovelace, I am here. Candace Ludwig. Amy Linden.
Amy Lyden, I'm present.
Lyden, thank you. Dr. Asia Lyons.
Present.
Sharon Mock.
Present. Sorry.
Michael Miller. I think he emailed us and told us he couldn't join, so I'll read the notes. Mary O'Hara. Dr. Camille Sinclair.
Present.
Dennis Streeter.
I'm here.
Angie Wold.
Here.
Annette Zachariah.
Here.
And our guests, Lloyd Moore.
Present.
Frank Cornelia. Scott Simpson. Michelle Muthring.
Wit.
Tasha Kankar.
Present.
And from our state agencies, Megan Shelton. Phyllis Reed.
Present.
Raquel Horde, Christopher Lebonwood. I'm really butchering that, and I am so sorry. Would you mind coming off mute and helping me with your name?
Not a problem. It is Chris Lobanov Rostovsky, and it's a very hard name to pronounce. And so nice try, and I am present.
Thank you. Kristen Toombs.
Present. Hi, everyone.
I also see on here, it looks like Andrea Jones.
Indeed, present. Good morning, everyone.
And Brittany Noble, one of our new regional engagement specialists.
Hi, y'all. I'm Brittany. I'm with Region 2. That's like Metro Denver, and then all the way west to Eagle and Lake counties, all the way east to Elbert and Lincoln counties. And I'm representing our team today. And I am still getting my life together this morning, but I'll be on camera soon.
Welcome. Thank you. I believe that's it for roll call, Caitlin.
Thank you so much.
Absolutely. Now we're going to go on and approve the minutes. So our meeting minutes are here in the agenda, and I'm just looking for a motion for approval. Motion to approve minutes, please.
Tasha Conquer, motion to approve minutes.
Thank you, Tasha. And a second for that?
Sharon.
Annette Zacharias. One of us can second.
Caitlin, you got that?
Yes.
Awesome. So the minutes are approved, and we will move on to the membership subcommittee updates, and we're going to welcome our new members. I'm going to turn it back over to Caitlin for the welcome.
Right. Good morning, everybody. Thank you again so much for being here today and participating in this wonderful meeting. So we have a couple of new members. So if the new members can come off mute and just introduce yourself briefly, I'm more than happy to call on you if you would like, but you just let me know.
I'll go first. Go ahead, Savannah.
Oh, Savannah.
Okay. My name is Savannah Brown, and I'm currently facilitating with the Summit Stone Health Partners Client and Family Advisory Council. My background is I have been an advocate for victims of domestic violence for many years. I've also done a little bit of activism work around homelessness issues in Denver and Loveland. And pretty much I love writing. I write a lot. I write essays, and I'm working on my first book. And pretty much that's it. And I'm really glad and thrilled to be here.
Thank you, Savannah. I'm going to go next. My name is Danielle House. I live and work here on the Ute Mountain Ute Reservation in Toyac, Colorado. I'm a Ute Mountain Ute tribal member. I'm half Ute and half Hungarian. I have 3 children, and I am an advocate here on the reservation working to get health equity. We are trying to do the best we can to help the Native people trust the system. And I feel like joining this council is one step further in helping my people. So thank you for the chance to be here. Thank you.
I guess I'll go next. This is Margie Grimsley with the Colorado Federation of Families for Children's Mental Health, and also a parent, family advocate, consumer, fit under a lot of categories. And I have, last year was my year off, and so I am rejoining the Planning Council and looking forward to being a member again.
Margie. Who else do we have today?
I'll go ahead and go. My name is Chris Lobanov Rostovsky, as we all stumbled through my name there. I am the Deputy Director of the Colorado Division of Criminal Justice. My background is that I am a licensed clinical social worker, having worked in the field for many, many years. And just so you know, we're seeing your email right now, Caitlin. I don't know if that's okay with you or not, but anyway, I'm a licensed clinical social worker, and I worked for many years doing direct service, providing mental health therapy to both victims as well as perpetrators of interpersonal violence. I was previously the program manager for our Office of Domestic Violence and Sex Offender Management, and only recently have come in to be in this position, the deputy director of the division. So that's a little bit about me, and I'm glad to be here.
Thank you so
Hi,
much.
everyone. I'm Dr. Sinclair. I'm a psychologist, a health psychologist and a neuropsychologist here in Colorado. I am originally from New York and moved here a few years ago, so I'm really happy to be here and part of this group. I work with clients who have medical conditions, specifically neurological disorders and trauma. And most recently, I created the Confident Caregiver Academy. That's a program helping dementia caregivers to better take care of themselves and their loved ones with dementia.
I'll go next. Hi, everyone. My name is Dr. Asia Lyons. I come here as a former educator in the Cherry Creek School District. I taught for a very long time and decided to leave education to support Black educator wellness and well-being. We have less than 1,000 Black teachers in the state of Colorado, and many of them are really struggling in their environments. And so me and my co-facilitator working together to create services to support Black educator well-being across the state. And then I also have a podcast where I interview Black folks who were educators who've left the field of teaching to archive their exit interview story, because a lot of us leave the field and don't share our stories. So that's a little bit about myself. And I live in Aurora and have a daughter, a husband, and a bird that you may or may not hear every once in a while.
That's awesome. What kind of bird do you have?
A cockatiel named Mr. Charming.
I love that. We had one when we were little kids named Tiki growing up, and he was loud.
He's very loud when he wants.
Thank you so much, Dr. Lyons. Anybody else?
I guess I will go next. I'm Kelly George, and I live in the San Luis Valley. I am a CODA. Both of my parents are deaf, so I can sign as well. I'm a former mental health counselor. I left the field because I have 4 special needs kids. All of them have mental health issues. I've been versed in pretty much everything because I worked in community mental health. So I've kind of done it all. I've been advocating for people with disabilities and mental health issues ever since I was little. I marched for ADA rights back in the 90s with my parents. So yeah.
Thank you so much.
And Bonnie, we forgot to say welcome to you during roll call. So I see you in the chat, and welcome, Bonnie. Any new members that haven't introduced themselves yet? All right, welcome new members. And we want to acknowledge the many volumes of documentation that we sent you to review. And thank you so much for joining our team and for reviewing that documentation. If there are any questions that you still have, or would like, just additional time to talk more about BPAC, please know that myself, Caitlin, the members, any of the folks on the membership committee who did that hard work to get all of that information out to you, or Hope, our chair, we're available to answer any questions you have offline. So I'll make sure you have our emails in the chat. And again, welcome. We're so happy to have you. And we're going to move along. Oh, I see Dennis has his hand up. Dennis.
Hi, all. For our new members, I am the membership chair, and I'm also involved in our community outreach, partnering with the BHA and now a number of BPAC members to do podcasting on behavioral health issues. So again, I invite you to contact me about any membership issue, questions you may have that may get brought up. But also I'm going to put my website in where you can see what the initiative is all about. And I am inviting anybody and everybody who wants to contribute to the podcast on information generated for the public about behavioral health issues in your particular advocacy. So again, welcome, and I look forward to working with more of you. Thank you.
Awesome. Thank you, Dennis. We're going to move along to our BPAC bylaws. We've got some updates there, so I'm going to hand it back over to Caitlin for those.
Thank you, Megan. So just quickly wanted to touch base with you all and let you know about the upcoming bylaw office hours that we're going to be holding. So it's going to be on October 9th and October 23rd at 9:30 a.m. So it'll be from 9:30 to 10:30 a.m. This is just to continue to work through that first draft of bylaws that I sent you all. And new members, if we haven't sent that to you yet, I know we sent you a lot of documents and information, but I'll be getting those over to you right now. So basically what we're doing with the bylaws is, I'm using air quotes for standardizing them. So when I first joined the state in April, my first task was to, again, standardize bylaws for our statutorily required councils. So what this first draft of bylaws entails is basically, a lot of the statutory language and then breakdown of some additional roles and responsibilities of council chairs and subcommittees and things of that nature. And so what we're doing now is we're meeting with council members to start going through that first draft and really start tailoring it to the specific needs of this council. So that's why I'm using my air quote standardize, is because we do have, that basic standardization, but now we really want to start making it unique to fit the needs of you and your council, and to make it understandable for the new members, current members, and any members that might join in the future as well. So I had sent a feedback form via email, which I will link again. I'm going to be sending a follow-up email after the council meeting, if not by tomorrow, by the beginning of next week. And that will include the form again. So you're more than welcome to go and use the form to provide feedback. But we also wanted to hold an additional space for any members who might like to come and join in person and kind of talk about the bylaws in real time. So again, the next office hours are going to be held on the 9th and the 23rd, and I will re-forward that Zoom information to all of the new members, and I'll just make sure that all of the current members also have the Zoom link for anybody who might be wanting to join as well. And so just wanted to kind of give a heads up about that. And our goal is by the November 7th meeting, so next month, to possibly vote these into, I guess, law, like just vote them into action. And so what we'll do is, based off all of your comments and feedback, I'll create that second draft of bylaws that will incorporate all of that feedback, and then we'll review it again as the council as a whole. And as long as you all feel comfortable with enacting that, we'll go ahead and take that vote at the next meeting on November 7th. I'm getting ahead of myself, November 7th. But if we need an additional time and you all aren't feeling comfortable at where those bylaws are by November 7th, we can definitely take a little bit more time and keep working through those. So that's kind of what the bylaw updates are. Is there any questions, comments, or concerns right now? All right, seeing some head shaking. All right. Again, if you need anything, if there's any comments, questions, concerns that you think of later, please don't hesitate to reach out. I'm always available via email, my cell phone number. Both of them are listed in my signature and my email. So please don't hesitate to reach out, whatever way is easiest for you.
And remember, the bylaws are how we govern ourselves. So this is important. And Caitlin's here to answer any questions, myself and Hope as well as your chair and vice chair. if you're thinking, gosh, I wish that we did a certain thing, or I wonder why that works that way, probably in the bylaws. So please participate. If you don't understand any language in there or it just feels confusing, remember you have a team behind you. We want to make sure we're governing ourselves in the way that feels right and appropriate for this work, because it is a lot of responsibility and we want to do it with integrity. We're just a bit behind moving on to our BPAC refresh. If you're a brand new member, you have gotten all of these documents in your inbox. And we're just going to go over them now to make sure that we're all on the same page. Hand it back over to Caitlin.
Megan. So first we're going to start with the council member training slide deck. So I am going to be dropping this in the link for everybody, dropping the link in the chat for everybody. I don't think I've had enough coffee yet this morning. So you can all go and review it at your own time as well. This is something that I've been working on creating. When I first started with BHA, I realized, some of the things that we were needing is just a little bit more organization and structure, especially for the new members onboarding that really hadn't been a part of the council previously. So this council membership training goes over a couple of different things. And I'll let you all review it at your own time on your own leisure. But again, the new council members have received this, and we're asking you all to complete that recap at the end of the slide deck within 30 days of appointment. And we'd really encourage the current council members to do so as well. Again, this is just, we're kind of using this meeting as, a refresher, regroup, getting resituated for our new federal fiscal year, with October being the start of the federal fiscal year. So we just want to kind of get all members up to speed. It's a good refresher for the current council members who, might have some questions that they just haven't reached out to ask or haven't brought up during conversation. So would just love you all to take a look at this at your own time for sure. And again, I'll be sending this link in the follow-up email as well. So as you can see here, we have our learning objective and roadmap. We have the basic structure of the Colorado state government and kind of where our our councils and subcommittees live in the Colorado state government. Then we have the breakdown of the BHA, including our mission, vision, values, and organizational structure for your review. Then we go into some of the statutorily required councils. So whether you're aware or not, we at BHA have 4 statutorily required councils, with BPAC being one of them. So in that, you're going to have a lot more breakdown of BPAC and kind of the roles and responsibilities and requirements of this council. It's also going to refer to some of the statutory language that you can look up. It's a federal statute, not a state statute. But so some additional information about the council in that section. Here, I really want to point out the state laws affecting councils. We, by law, are required to abide by a couple of different laws. We have CORA, which is the Colorado Open Records Act. So we're able to be subpoenaed, basically. So all of our emails, text messages between council members, videos, things like that, that can be subject to request by an attorney if it is ever brought up. So it kind of highlights some of the details around CORA, what may or may not be subject to CORA and things like that. We also have one called Open Meetings Law. And so basically, any meeting that has 2 or more council members together talking anything about council needs to be available to the public. And so it kind of, again, describes a little bit on what the Open Meetings Law is, when you have to abide by that, and things of that nature. Then we have the Ethics Handbook, that is a Colorado statute, as well as the Disabilities Act. So those are a couple of the state laws that we are required to abide by. And so we really just want you to be familiar with those. Hopefully we'll never have to be, CORA subpoenaed or anything like that. But if we are, we're all going to be ready for it, and we're going to be recorded and up to speed on all of that. So great information for you all to look at as well. Then here we dive into a little bit of the council member responsibilities as well as BHA responsibilities. So we go over some things such as like Robert's Rule of Order. So when you hear, for example, Megan making motions and things of that nature, that is the terminology that's going to be included in here on Robert's Rule of Order. So if you can take a little bit of look at that and kind of get familiar with some of the basic terms that we'll be using throughout the council, that would be really helpful for new members as well as current members who might just not know why we use the certain terms that we do. And then lastly, as we scroll through our slide deck, coming down to the end, if my computer will load, there we go. You have this recap button where you click on, and it will take you just to a little recap quiz. It's only 10 questions. It's not even pass fail. It just basically kind of goes over some of the information that's included on the slide deck and really wanting to make sure that you understand things about like the open meetings law and things of that nature. So again, don't get upset if you're nervous, if you're a nervous test taker or anything like that. We're not grading you on this. You're totally fine. It's more just to make sure that we know that you've seen this slide deck really. So I know myself, I'm a horrible test taker, so I don't hold that against anybody. But just wanted to kind of bring this to y'all's attention. Again, this training slide deck that I've been working on, we've sent it to our lovely SAMHSA TA and Denton to review as well and to provide us any feedback. Hi, and good morning. Thank you so much for being here. And so we'll get some feedback from her, but also feedback from you all. So as you are going through this training slide deck, if there's information on here that you all, have additional questions over, or if there's information that you don't find in here that you would really like included in this training slide deck, we are completely open to feedback. We want your feedback, your positive criticism and things of that nature, constructive criticism, so we can develop this and make it stronger for, again, onboarding members and members in the future as well. So any questions about the training slide deck right now? Seeing some head nods.
And just
All
a
right.
note that yes, it can feel overwhelming, right? Statute and Cora and all of these things that you're maybe thinking, what on earth is all this? We want you to know that it's okay if you don't immediately absorb all of that information, and that we're here to help clarify anything. And also remember, we're all human beings living big, huge lives and doing amazing things in our communities. So we're also in collaboration together as community leaders who truly care about this work. So please do not feel as though it is simply a statutory exercise. This is a great group of human beings doing really great work. Let's hand it back over to Caitlin.
Thank you, Megan. All right, so next is our letter of commitment. And so this is actually done in some of our other statutorily required councils. And so this is something that we're kind of implementing across all of the councils within BHA. And so basically what this letter of commitment entails, and I will be sending this to each member individually, because as you'll see right here, it's going to have your term limit on here. And so I'm going to be tailoring this to each of you individually that will have your current term limit on there for your review. And basically what this is kind of saying is that, this is an introduction as to what the council is. This is saying that, you're agreeing to participate in this council and that you understand that this is an advisory body, not necessarily a decision-making body, but that your input and your voice is extremely valuable. And this is how we're really going to start, using your voice to restructure the behavioral health system throughout Colorado. Some of the information that's going to be included here is, basically just, typical run of show. It's going to have your term limit on here. It's going to be asking you to make sure that you understand that we're asking you to join the council meetings on the first Thursday of each month, or, if we have to have a special sessions meeting, if you're available to join there. We're asking also to, give us a heads up if you're not able to attend one meeting, if at all possible. Excuse me, the mailman's here. We had a couple of members email us this week saying, hey, something's come up, not going to make it. I'll review the agenda and things like that after. And that's basically all we're asking. If for some reason, something happens the day of the meeting and you can't let us know ahead of time, that's completely understandable too. All I'm really asking here is for just continued communication. What we just don't want to happen is you just stop showing up to meeting, you stop responding to emails, you stop participating altogether. We really have no idea what happened, if you're okay, if you need assistance, anything like that. So that's basically all it's asking here, is that you just maintain communication with us if you have to miss a meeting or something of that nature. We're also, asking you to maintain, keep up to date with activities, any action items that we might have come up, such as, a online vote or something like that. For example, we just submitted our annual letter of recommendation for our block grant, which you'll learn more about during our SAMHSA presentation. But we had members take a vote via online form. And so it's just small action items like that, that we're asking you to maintain that participation and engagement, and do some assigned tasks and action items as they come up. Next, we want to hear any concerns, comments, questions that you might have. Please do not hesitate to reach out to me. Again, my virtual door is always open. I'm also pretty positive I can say that for Megan and Hope as well. And then I have my wonderful boss here, Andrea Jones. She's also available. So we really want to support you in your endeavors and the strength of this council. So anything that we can do to help address any concerns that you might have or answer any questions that you might have, we're here and we want to be available to you. And then lastly, on your side, it's just, saying that, you're willing to engage in constructive conversations, that you're going to be respectful of other people's viewpoints and opinions, and really, just to be a good person and be a good member of the council and be respectful and all that good stuff. So that's kind of what we're asking of here. Down here, we're talking about potential conflicts of interest as well. And I've been working with Hope and Megan. We're talking about creating a conflict of interest just form for you all just to sign. And basically all that's asking is that if you know that you might have a potential conflict of interest over like a specific topic or a conversation or a potential vote or anything like that, we're just asking you to let us know ahead of time. It's not that you're going to be kicked off the council or anything like that. You might just not be able to participate in that vote, for example. But we just were asking you to let us know ahead of time if you notice any potential conflict of interest arising. Last year, we have that we're asking you to complete the training and comply with the applicable laws as we've previously discussed. Again, here is kind of what we're talking about with that consistent communication. So in the bylaws, you'll see it's kind of broken down a little bit more than what we have here. But for example, if you miss 3 meetings in a row, let's say we don't hear from you, you haven't let us know that you're going to be missing a meeting, you've stopped responding to emails, we just haven't heard from you in basically 3 months. Hope and Megan, your chair and vice chair, are going to reach out to you to say, are you okay? Do you need help? Do you need to take a pause from the council? Is there anything that we can do to assist you? If we don't hear any response from you then, and you miss another 2 meetings, so basically 5 meetings in a row, so 5 months total, 0 communication, stopped responding, everything like that, we will have the opportunity to go back to the commissioner just to refill that seat. And it's not anything to be personal or vindictive or anything like that. We just need to be able to establish a quorum, so that is 51% of all members at every single meeting, so we can keep the council moving forward. That's how, we have to establish a quorum in order to be taking votes, in order to be passing motions and things like that. And so if we just have so little participation from members, we really need to get that engagement level back up so we can just keep moving forward. Since we only meet once a month, it's really important that we do as much as we can in the little time that we have. And so that's basically where that comes from. But if you have any questions or concerns around that, please do not hesitate to reach out to myself, Hope, or Megan. We can definitely talk to you about that more and answer any questions that you might have or address any concerns that you might have. Last year, it's basically saying that, just because you're serving on this council doesn't mean that you're necessarily a state employee, and so you wouldn't be entitled to employee benefits such as like workers' comp and things like that, since this is an advisory council and you're not necessarily a state employee, except for the people who are state employees on here. And that has something to do completely different. So, and then last down here, this is kind of going over what BHA is committed to. So here we're going to be providing you with the administrative support during the council meetings, such as, the agenda creation and Zoom accounts and things like that. We're also going to be sending you, information about upcoming meetings, town halls, community conversations that our community engagement team has started to run. And so we're just going to try and keep you in the loop as much as we can. We are also working on a compensation package for all members who are eligible. So that is excluding state employees and any position that is statutorily required. It's like a statutorily required facility. So we will break that down a little bit more. We are in our finalization process of compensation. We're hoping by November 1st that we'll get up and running again, and then we will dive into that a little bit more with the realm of compensation. And then lastly here, it's the same as what we're asking of you all, to respect your viewpoints, your different backgrounds, your unique voice and things like that. And so here we just have that disclosure saying basically, again, you're not a state employee, so you wouldn't be entitled to state employee benefits and things like that. And then we're just asking you to sign, date, and return it to us by November 1st, if possible. So again, I'm going to be sending this out in the follow-up email to everybody. It will be unique to you, as it's going to have your exact term limit on here. And then if you come up for a second term and reapply to the council, we'll just have you sign another one with the updated 3 terms of service here. So any questions about that? I know that was a lot of information kind of thrown at you right now, but again, all of this is going to be sent to you in an email, and you'll have a little bit more time to review, and then I will be available, and I'm sure Megan and Hope as well, to answer any questions that you might have pop up.
And to clarify, we understand that conflicts of interest could arise, most certainly, because many of us wear many hats. And so part of your responsibility would be to recuse yourself from a vote that would be in the space of conflict of interest. Does it mean you can't be in the meeting? No. If they're talking about your organization, well, yes, you recuse yourself from that moment. But please, still, you are welcome in the space. By signing the conflict of interest form, you are acknowledging that, well, like the rest of us, we're all wearing several hats. So don't let that conflict of interest scare you away from participation. And there's somebody I interrupted, so I yield the floor and apologize for interrupting.
This is Laureen. You're fine, Megan. No, don't worry. So can we email this back to you, or are we going to print it out and mail it back with snails?
Nope. Email is perfectly fine. You do not have to go to all that trouble of printing and mailing and all that jazz. So you can just click in. I will have it in a version sent to you that is editable. So you can go in and just type your name if that makes the most sense. If you have Adobe and can do your signature fields in there, great. If you need help signing it, let me know. I'm happy to jump on a quick Zoom call and we can share screens and walk through this together. So any help.
Yeah, I might have trouble with this signing.
Absolutely, not a problem.
The rest of it is cool.
When I send this out to you, you just reach out to me and let me know a date and time that would work best for you. And we can do, a quick 10-minute phone call to walk through this and get it signed for you. And again, I'm available for any member who might need help to do that.
Okay, thanks, Caitlin.
Of course. Any other questions? All right. So we keep moving on time. Wanted to quickly review our council member code of conduct here as well. So basically here, we are starting to, again, introduce some of the councils, and we state here our BHA mission, vision, and values, again, just for your awareness and understanding. Now down here is where we get to the specific code of conduct, and there's only a couple that we're asking of you, and they should be pretty reasonable, what I think, but first and foremost is respect. We want you to respect each other as we work together. Behavioral health can be a very challenging and emotionally driven topic sometimes. And so, if conversations start getting heated and things of that nature, we just ask you to be respectful of everybody's viewpoints and things of that nature. Next, again, is we're just asking for attendance. Again, we realize this is not your full-time job and we don't want it to be your full-time job. We completely respect that you have a life outside of this and this is your voluntary time, and we appreciate you for being here. Again, we're just trying to assure a specific level of attendance so we can keep this council moving forward, since we only do meet 12 times a year. So again, if you have to miss a meeting and you know ahead of time, if you could just drop us a quick chat or an email or a text, whatever easiest for you, just to let us know you won't be participating. Or if you have to miss a meeting and you didn't let us know ahead of time, if you could just follow up and say, hey, so sorry, missed that. I'll review the agenda and the follow-up email. That's all we're looking for when it comes to attendance, really. Again, participation. So we're asking you, when I send out the email a week in advance with the agenda, we're just asking you to review the information on the agenda, review the slide decks that might be linked there. As you can see, I'm going to go back to the agenda. All of these in blue are hyperlinks. And so you'll be able to click on that and go to the aforementioned, sorry, I was clicking on too many things, aforementioned link here. So if you have any questions about that, again, don't hesitate to reach out. If you need it in like a PDF format or something like that, I'm happy to do that as well. Please just let me know whatever's easiest for you. So again, just kind of come prepared, ready to review the information for the day, discuss some of the topics that might be on the agenda. Next, is just engagement. We're just asking you to participate in these conversations and share your point of view and the point of view of your communities, because you are all so unique to this council and you all have such versatile and unique backgrounds, and we really need that viewpoint that you have, that unique experience that you have, both lived and professionally, like personally and professionally. So we're just asking you to engage in the conversations. Again, complete forms when they need to be, and all that kind of thing. We're also asking you to for a level of professionalism. I think all of you as council members have held that level of professionalism wonderfully, and we're just asking you to continue to do so. Lastly, we have our obedience of applicable laws. Again, that's in the training slide deck, and we've mentioned it a couple of times in letters of commitment as well. But some of the ones that are going to be really high important for us is like FORA, open meetings law, and things like that. Again, they're listed in that slide deck that you will be sent if you have not already been sent it. And then if you have any questions about those in more detail, don't hesitate to reach out. If I don't know, I can automatically go to Andrea, and she is wonderful about that. She is our statute law expert, and so I will automatically refer you to her if there's something that I couldn't help you with, but we will get you that help. And then lastly, we're just asking you to complete that new member onboarding of the training slide deck and that recap, and sign and return your letter of commitment. So that is just our code of conduct that we just wanted to make you all aware of, that we've been working on. And this is not just for this council, this is for all of BHA councils across the board. Any question about that?
And just to be mindful, Caitlin, we are at time for a break, and we are only 6 minutes away from welcoming our amazing SAMHSA team. And so just a question for the group. Would you like to engage in the 5-minute break and move the council subcommittee audit conversation? Or would you like to have the council subcommittee audit conversation as opposed to a break during this time? What is the pleasure of the group? Hearing none, Caitlin, shall we move the audit conversation, or should we have it really fast in 5 minutes? Because we certainly want to leave space for Tracy and the team.
Well, since we have our SAMHSA TA expert here, and if we could just do it really fast. Anna and I met yesterday and wanted to kind of bring up some ideas that she had around our current subcommittees. And so if we look at the BHAC website, we have our subcommittees listed down here. And since I have started, we really haven't had a lot of them super active. And so some of the ones that we do have currently standing and active is our membership subcommittee. As Dennis Strader introduced himself, he is the chair of that subcommittee. as well as our steering committee. This is the subcommittee, our executive steering subcommittee that, creates the agenda for the upcoming meeting and helps with, some of the administrative back-end stuff of the council. So after talking with Ann Denton yesterday, we are wanting to review some of these subcommittees and possibly condense them, if at all. And Ann, would you mind to
I would
speak to
love
that a
to.
little bit more?
I would love to. Thanks, Caitlin. I'm Ann Denton. I am your assigned SAMHSA TA provider. And I met with you a couple of months ago and introduced myself, but for the new members, that's who I am. And our SAMHSA TA has been approved. So I am at your service in terms of the restart that you're looking at doing. About committees, while you're considering your bylaws this month, I would suggest that you might want to take a close look at how your committees are structured. Caitlin tells me that a number of the committees that were just displayed are inactive. And so I just wanted to share, most councils have subcommittees that are linked to one of their three, to their three mandated responsibilities, which are the block grant review, system level advocacy, and then data and monitoring. And so a typical configuration might be a steering committee like you have. It might be a block grant review committee that may include the data function. So that's two committees. A third committee would be system advocacy, which encompasses adults and children's, or you could have an adult committee, adult system advocacy committee, and a children's system advocacy committee. That's three though. So steering committee, block grant review, system advocacy, that's three. And if the block grant review incorporates your data and monitoring, you've covered your SAMHSA mandated functions. Also, most councils have a membership committee because membership is so vitally important to the council functioning. And then some councils will have what, it has a million names, but it's basically an operations committee. And that's the committee that might be drafting new bylaws. That's the committee that might be, monitoring how the council is functioning, right? Are things being done on time? I'm not sure you need that. But so my suggestion is, when you're looking at your bylaws, take a close look at how those committees are structured. I would recommend that you think about having a smaller number of more active committees. And you've got so many, as you were going through the new members, I was like, wow. And I've looked at the roster of existing members. The level of talent and energy in this group is high. Where do you want to focus that, right? And so I also read your letter of recommendation for the block grant, and I commend you for asking for the information that you need to actually genuinely address the block grant review. So I'm done. Thank you, Caitlin. And if anybody has any questions, let us know.
Thank you. And Anna's here to help us learn how to teach you all to review that block grant. And so this year, it was a challenge for us, for you all. And so Anna's going to be here to help us prepare for next year, to help us show you the information that you need, to help us get organized, to help you all get organized. And so we are really looking forward to having Ann, and we're going to be utilizing her greatly. So I know that we're at time for our meet and greet with our SAMHSA regional directors. I would like to, if it is okay with the council as a whole, potentially talk about the restructure of subcommittees with the executive subcommittee, and then bring this back to you all as the council as the whole at the November meeting. Is that agreeable to everybody?
Yeah, Caitlin, I was going to comment on something like that very quickly. My experience with the council is that when before COVID, we met in person, and then we split up after the main meeting and had subcommittee meetings. And that became more difficult with the Zoom And so I was wondering if Anne could just come up with a list, not now, but for the future, because we're in a hurry. What do the other entities that you deal with, how do they handle those meetings? Because I think that's the major deterrent to our operating more effectively. That's it. Thanks very much.
Thank you for that.
Most certainly, with any executive committee meeting, the decision is still with the body of the whole. So
Yes.
while we will have those discussions within the executive committee meeting, that will come back to the group, Maureen. And so we won't be making any decisions without the body of the whole.
I didn't think that we would.
Good. That's not how we roll.
No, I know. I think there might be a misunderstanding about what I said, but I'm fine with that. I live my life being misunderstood. I just want to move on to the folks who have been waiting to present to us. Maybe
Fabulous.
Megan, we can talk about it later.
Yeah, let's chat about it. Thanks so much. Any other questions about that before we move on to our meet and greet? And Caitlin, do we need a motion for voting through the executive committee discussing the subcommittee
Yes,
audit?
if that's the wishes of the council, that's completely fine. We can definitely make that motion.
All right, motion for executive committee to discuss audits. Is there a motion on the floor?
This is Annette. I move that we let the executive committee sort of do our audit.
And is there a second?
Second.
All right, thank you. Motion carries. And moving on to our meet and greet. Turn it back over to Caitlin.
Thank you, Megan. All right, so at this time, we are going to be introducing our regional directors with SAMHSA. So before I began with BHA, I know that you all had, I believe his name was Charlie, our former regional director, and you all had a wonderful relationship with him. But now we're going to be developing a new and amazing, wonderful relationships with Tracy Poole and Morgan Seller. Morgan, please correct me if I pronounced your last name wrong. Seiler. Thank you so much. All right. And Tracy and Morgan, I've made you both co-hosts. So I'm going to stop sharing my screen. So you all feel free to share your screen with the slide deck. And I'll just pass it over to you all.
Thank you so much. Appreciate the opportunity to be with you all today. Also with us, Morgan and I have added 1/3 capacity to our tiny little office. And we have Meg Leverton on the phone with us. She joined us. She's coming in hot with all the meetings that we've been loading her up with. She joined us a week ago Monday. So closing out her second week. So we invited her to be in space with you all today. So you get the opportunity to ask us questions and spend time with us as we kind of give you a little 101 on SAMHSA. But we hope this won't be the only time that we're invited to present and spend time with you all. We want this to be a very open and collaborative relationship. And so not a one and done. And so we're happy to participate in whatever way feels right for you all as we move forward. So as Caitlin indicated, I'm Tracy Poole. I serve as the Senior Regional Advisor for the SAMHSA, so Substance Abuse Mental Health Services Administration in our Denver Region 8 office. And with me is Morgan Seiler and Megan Leverton as well. We can go to the next slide. No, a typical slide for us, this claiming we have no financial disclosures for the presentation. And here's a little bit about what we're going to discuss with you all today. We're going to give a relatively quick overview on SAMHSA, and we certainly invite future conversations if you'd like us to do a deeper dive on anything specific that we talk about in the next few slides. We put together a few slides that highlight a little bit about what's coming into the state, your state regarding our portfolio, and then we have resources and opportunities that we hope you know about, just in terms of ways that you could stay more connected to our portfolio and how we could be better support to the work that you're doing for all people living in Colorado. So first, let's learn a little bit about who we are as an agency and what our mission is, where our focus is. So SAMHSA, as I indicated, who we are, the Substance Abuse Mental Health Services Administration, we sit in this large umbrella, underneath this large umbrella of the Federal Department of Health and Human Services. And then you'll see a variety of different operating divisions reflected here. There are 11 total reflected here who we partner very collaboratively. As I indicated, Morgan, Megan, and I are in our Denver Region 8 office. So in addition to Colorado, that includes Montana, North and South Dakota, Utah, Wyoming, and 28 tribal nations that we serve in that Region 8 capacity. Since you've met the entire staff of 3, we really lean into these partnerships very heavily on the work that we do. And we believe all of these entities have a space in this behavioral health journey, whether it's through a health promotion or a prevention lens with our friends at OASH, and our friends at CDC, whether it's the primary care lens and growing a workforce with our friends at HRSA that you'll see reflected here, whether it's our partnership and our friends with our researchers at the National Institute of Health, again, whether it's our healthcare delivery folks within the Indian Health Service with our tribal and indigenous communities. We can't do our work well without the successful partnership of those seen reflected here. Next slide. Thanks, Morgan. So this is our strategic plan. This is essentially our 5 key priorities that you'll see reflected here in the green circles. Our focuses kind of fall in these 5 spaces. That does not mean we don't do other things, but I would like to just call these out. The text is remarkably small. So enhancing access to suicide prevention and mental health services, promoting resilience and emotional health and well-being for children, youth, and their families, integrating behavioral and physical health care, strengthening the behavioral health workforce, and preventing substance use and overdose. Along the right side in the blue kind of bubbles, if you will, are 4 guiding principles, and these are integrated into all of our work and activities at SAMHSA. Equity, trauma-informed approaches, our commitment to evidence and data, and then, of course, the idea of recovery and that people do recover. And then I'd be remiss to not introduce our Assistant Secretary for Mental Health and Substance Use. Reflected here is Dr. Miriam Delphin-Rittman, who has been leading SAMHSA for going on 4 years and is just an incredible leader and ambassador for the work that's happening across our communities. So when Morgan and I talk about SAMHSA, we talk about what we offer in kind of 3 different buckets that you'll see reflected here. We certainly are known for our funding and our grant opportunities, but we also offer a variety of different training and technical assistance for providers, for communities, for peers. And then we offer a plethora of resources, anything in the kind of evidence-informed related space, all the way out to just trying to make good sense of policy and legislation that's coming out the door and what that means for you and for other citizens across the state. So we're going to talk a little bit about that. As I indicated, we are in the Region 8 office that you'll see reflected here on this beautiful map. But we also have 9 other regions across the country. I think we use this slide really to show folks that about 85% of SAMHSA's team is based in the Rockville, Maryland area back east, but the remaining 15% of us are in these regional settings, and it's really intentional to be closer to the folks on the ground doing the work. We see ourselves kind of as consultants. We spend a great deal of time responding to asks to do presentations, inquiries about funding and training opportunities, and whether or not that would be a good fit for you or your organization or your community. Really serving as a bridge between maybe a grant that's happening in community and someone wants to get to know whether or not they would be a good sub-partner with that or have a better understanding of how that works. So while we don't carry a big fat paycheck or a big fat purse to be able to offer direct money in a regional capacity, we do find that we have to kind of understand what's coming out the door from headquarters and how that matters and shows up in our respected communities, our state and our tribal nations and our local community organizations. So we encourage you to kind of explore some of the other offices. Morgan has put our QR code there for additional info. So our purpose, I kind of got to this on that previous slide as I was talking about the role of the regional office. We really pride ourselves on kind of having a pulse on what's happening at that national level, but we also really welcome the partnership with you all, because this is where we hear, hey, Tracy, this isn't working, or this doesn't make good sense, or this isn't going to be delivered or implemented in the way that it was designed at that 20,000 foot level kind of think tank. We need you to help us be stewards and kind of carry this language back. So we do this in a very consultative way with our entire portfolio, not, just the grants and technical assistance coming into the state. So it's really, again, as I indicated right out of the gate for you all, it's a partnership, a collaborative that we welcome and embrace, and are super privileged to continue to learn and grow with you all and by the information that you share with us. Just want to highlight and reflect a couple of things that are happening across the region where Morgan and myself, and now Megan, we spend a significant amount of time on. So in addition to the portfolio that's happening at the national level, we pride ourselves in hearing from local communities and saying, can we spend a little time carving out space and diving into some of those things. So as you'll see here, we've reflected a couple of those particular activities. I know there are a couple of folks on, hi Jenny, that are working in the food and mood related space with us, really looking at kind of the intersection between nutrition and its role on mental health and substance use disorder. Morgan's leading some tremendous work in the space of physical activity and mental health and substance use, and really kind of partnering with our colleagues in the Office of the Assistant Secretary for Health and kind of looking at how to better integrate kind of mental health and substance use into the physical activity guidelines, which is really, really novel and groundbreaking. Unfortunately, it shouldn't be, but it is novel and groundbreaking. We've got quite a bit of work happening in the harm reduction related space. We've got a lot of youth-led youth expertise happening in partnership with a lot of young leaders from across the region, and especially some tremendous youth leaders in Colorado that have been front and center, and we've been really fortunate to partner with and pay and spend really good amount of time learning from and hearing from over the last couple of years in our journey. Our LGBTQ space, our maternal and mental health space, there's just a variety of different areas. So we encourage you to check out our QR code to learn more.
Tracy, this is Megan, and I wonder, are we saving our questions until the end, or do you prefer that we ask the questions as they come up in the chat?
Great question. Why don't we save them to the end, and we'll kind of close out if that works, Megan?
Works great, thanks.
Perfect. Okay. So as I indicated, we do this work in a consultation in a collaborative way. What you'll see reflected here are a handful of those collaboratives that we have going on. If you can remember from that umbrella slide with that alphabet soup that you saw earlier, all those folks we spend a great amount of time with those folks kind of unpacking this. So if you were to raise a question around Olmsted and wanted to bring that to us, we would have a variety of different partners kind of problem solving and troubleshooting and thinking about it through a technical assistance lens. I want to make really, really clear that our office doesn't have that regulatory harm, that we are in this space to make good use of the funds going out the door and making sure folks need the services or getting the services in a way that works for them. Okay, Morgan, let's see, what do we have next? So a couple key features when we talk about behavioral health that we kind of live and breathe and kind of walk this talk at the regional office. And I think everybody showing up in this space today probably would agree and have additions to add to this. But emotional health and well-being are vital to our overall health. We see mental illness and substance use disorders as chronic illnesses, right? This is healthcare. Equitable access to behavioral health treatment is critical, and it's we need to be thinking about this as a public health strategy through a public health lens, really encouraging that health promotion piece all the way out to recovery. And it's very cyclical. And it's important that we see this again through kind of this population public health strategy. Our science is there that shows behavioral health treatment is strong. People get better, right? That's what we do. We bring people to treatment and they get better. Behavioral health should be integrated and coordinated across public health, physical health, rehab and recovery, and our support services. Again, it's a vital piece to a whole human healthcare. Vital behavioral health treatment must be tailored for and with the individual, having the individual at the center, driving the conversation around how they want to receive care, what works for them, and ensuring that we have community wrapped around them to make sure that they have that opportunity to get better and to recover and to contribute to the environment, the community environment. And then all of this is kind of run by a well-trained, competent, and current behavioral health workforce, and that this is essential. You all are a part of that workforce in this planning and advisory role, but also in your day-to-day lives, right? We all have a place to contribute to this, whether it's bringing our own lived and living experiences to the behavioral health conversation, whether it's something that we've, gone to school for, whether it's something that we've been operating in a kind of peer-related services, we all have to contribute from a workforce standpoint, and this is essential.
Thanks, Tracy. So in the next two sections, we're going to explore the SAMHSA resources coming into Colorado and some resources available to you at the federal level as well. So this is actually a snapshot of the current SAMHSA grant funding coming into Colorado, and we pulled this data down on September 30th. So just knowing that on a rolling basis, and especially given that we've just rolled over into a new fiscal year, there are definitely lots more funding streams coming into Colorado from our various grant programs that are on the horizon. And so if you want a current snapshot of this, we're happy to provide it at any point. But you, as of September 30th, have 78 of our grants, including formulary or block grant dollars, which are calculated based on the number of people in a state and other metrics. Discretionary funding, which you competitively applied for in order to receive. So various state agencies and nonprofit organizations actually put in an application against other folks who were trying to get the funding too, and you were awarded that and received it. And these 78 grants total around $110 million coming into the state each year. And so you can see in the map to the right, the geography of these grantees, most of which are awarded to state agencies, hence the concentration in the Denver metro area. But like I mentioned, we're happy to provide a list of current grantees or help make connections to folks where there may be overlapping programmatic goals and objectives. That's actually one of our main jobs in the regional office. So let's take a little dive into some of the resources available to you, not only as a grantee, but actually as a taxpayer, and how you can stay plugged into future funding opportunities, resources we share, and trainings that we can offer. So SAMHSA stands up several help-seeking resources. The first is Find Support. This is a great place to start if you'd like to talk through whether or not you or someone you care about has challenges related to mental health and substance use. The next is findtreatment.gov, which is a Department of Health and Human Services, so that, again, that umbrella, widely supported resource that can assist in finding treatment providers in your community. And the third, which I'm hopeful most on this call have heard of before, is the 988 Suicide and Crisis Lifeline. So this is formerly a lengthy 1-800 number. And this 3-digit call, text, and chat line aims to be that universal entry point to reaching a trained crisis counselor who can help with thoughts of suicide, emotional distress, and/or substance use crises, or all of the above. So there are actually materials available to get the message out about 988 and are free for anyone to order. So again, you don't have to be working for the state or working for a nonprofit agency to order these materials. You can get them for your church or for your local hair salon, wherever you think it makes sense to have these materials, you can order them. And the 988 Suicide and Crisis Lifeline store is terribly named because everything that you order there is actually free. And so the QR code will take you to where you can get these resources. There's also a lot of print materials that can be printed from a home computer or from your computer at the office, if that's easier for you to get those things in your hands sooner. In addition to the immediate support-focused resources that SAMHSA has, we also support over 50 training and technical assistance sites, including population-focused centers of excellence, like our American Indian and Alaskan Native Behavioral Health Center of Excellence, We have topical focused resource centers like our Suicide Prevention Resource Center, and we have care continuum focused centers like our Prevention Technology Transfer Center. So all of this probably sounds like a lot of overwhelm and lots of resources out there. And so this QR code will actually take you to our full menu and the section of our website is labeled practitioner training, which we're working to sort of relabel because most of the resources were originally aimed at strengthening the skill set of the behavioral health workforce, so counselors, substance use professionals, but now we have offerings within most of these centers to strengthen the skill set of all community members. So we really encourage you to take a look at that. If there is something that you're curious about or want more training on, you can see what's available there. A lot of the things are virtual and really accessible to anyone across the country. The last training resources we wanted to highlight is our State Program Improvement Technical Assistance Center, which is specific for block grantees, and it's so great. I believe Anne spoke a bit earlier before we got on the call and started presenting, but this is definitely going to be helpful as this council explores recommendations or identifies specific training needs in your work, including specific training around how to structure a council and what those examples look like in other states. So I'm very thankful that you all are receiving that assistance. And finally, we want to invite you to stay connected. SAMHSA email updates can be tailored to what you'd like to receive notices for, including grant announcements, new resources and publications, and training based on a specific topic area. So please explore this. I know we provided the slide deck to Caitlin and the team, and so you can click through at any point and utilize some of these links that are embedded, and or you can reach out to us. Our contact information is here on this slide. And we really just thank you all for the invitation to come and present and share. And as Tracy mentioned in the beginning, we do not want this to be the last time that we interact with you all. So please reach out to us where that is what we're here for, is here to help. So.
Thank you. That was a fantastic presentation and so much information. We're grateful to have y'all in your leadership roles doing this work. Let's open up the floor to questions for SAMHSA. And if you see your question in the chat and it didn't feel as though that was the answer you were looking for, please come off mute.
Yep.
Yeah.
Yeah, super great questions. We have two, Morgan, I'd love for you to talk about the school-based mental health, but we've got also have a center of excellence for the 0 to 5, the kiddos that does it's a consultative center of excellence. So there's just a really great opportunity for ECE providers to understand kind of warning signs and how to have conversations with family for that really young population, which is really vital, especially as we're transitioning kids from that early childhood phase into a school-based setting.
And I'll just mention, SAMHSA has 2 concurrent cohorts of Project Aware in Colorado, helped stood up by Phyllis Reed and her amazing team. And actually, I am the former Project Aware Great Manager for the state of Colorado, so have a lot of experience in leading that work, right, for the state, but then also worked at a school district level. And now that I'm here at SAMHSA, help create space for states in our region to get together, share best practices, and share ways in which the project is actualizing in their community. And AWARE stands for Advancing Wellness and Resilience in Education. And it is aimed to do exactly that, building state-level infrastructure for school-based mental health systems within a multi-tiered system of support. So if you're not from the K-12 space, that is, making sure that you have those prevention resources, those small group resources, and then those individual and highest level of care resources in school settings. So definitely happy to help connect to any of the resources that we have available on our website, and would encourage you to actually reach out to the Colorado Department of Ed if you had specific questions about how this rolls out in our state.
Thank you, Morgan. I have a question actually, just about like whom would it be within that Department of Education whom would be able to appropriately answer those questions and then just sort of maybe assure that that work provided by SAMHSA is provided with integrity within our schools across the state?
Yeah, great question. So Phyllis Reed is the Director of Health Education and Physical Education at the Colorado Department of Ed, and it is in that umbrella, sort of within that student support services arm of the Colorado Department of Education, that this work lives. So Phyllis, do you want to add anything about who the right point person would be?
The only thing I would add would be our Project Aware team members, and our team lead for Project Aware is Chauncey Stevens. And so she would definitely be an appropriate person to answer all these questions.
Thank you so much, Phyllis. And I'm curious if you wouldn't mind, if you have it available, just dropping Chauncey's information into the chat there so that we can easily access your team lead.
Absolutely, I'll be glad to.
And I just put the link also for the section of the Colorado Department of Education website, right, that highlights all the contacts for Project Aware, as we also have someone who, Project Aware has someone who sits at the Behavioral Health Administration as well. So part of that project is having co-coordination across state agency. And so that person actually has a half-time FTE devoted specifically to Project Aware, in addition to their roles and responsibilities within the BHA. So.
Great information. Thank you. And any other questions for our SAMHSA team? I see Bonnie's hand up.
Hello, this is Bonnie, and actually this is around Project Aware. My colleague Kyle is the person who's half and half, and he is wonderful, and I'm happy to connect anyone to him. And actually I see Morgan's on here. I think Morgan and Kyle also used to work together, but both Kyle and Chauncey are amazing. I'm happy to facilitate any connections.
Hi, Bonnie.
Thank you, Bonnie. We appreciate that. We're about 2 minutes before our next agenda item, but we want to make sure we give everyone on the council space to ask their burning questions to the SAMHSA team before we move on.
I just want to call out the question regarding kind of suicide prevention and the numbers, because I think it's super, super important topic. And there's a lot of work being done in this space. That's probably a whole separate call. But I don't know if there's anyone on from Lena's team, but the suicide prevention lead for the state, but I know she's leading some incredible work. In fact, we learn quite a bit when we spend time with her. And there are a variety of states that are, so I'd love to, as I put in the chat, I'd love to just kind of have a side conversation if that would be of interest. So for anyone on this call, and we can certainly pull in kind of our suicide prevention office at SAMHSA, who are kind of leading the charge in this space for a future call. If you'd like to carve out, half hour or something for them to give a presentation, they're always available for that.
That's fantastic, Tracy. Thank you. And perhaps Caitlin, in our follow-up email, we can ask the crew if they would love to have a deep dive into that space.
Absolutely. And Tracy, is it okay if we link your email address into the chat? Perfect. Thank you.
All right, we are at 10:20. Time to move on to our updates. And also thank you again to the SAMHSA team. We are blessed to have your leadership in place. And I know moving forward, we will be engaging robustly around all your amazing opportunities.
Thanks so much for the invite.
Yes.
Yeah, thank you.
Thank you all.
What's going on? Let's hear from prevention.
Well, actually, Megan, if it's okay, if we can move community engagement to right now, Judith is helping the commissioner and she is on a time crunch. So we're just seeing if that's okay with you all, if we just bump her up a little bit.
Let's do it.
Thank you. All right, Judith, it is your turn. Take it away.
Thank you. Can you all hear me?
Awesome. Thank you so much. I appreciate your flexibility. I do need to head out. We're very excited to, our next stop on Commissioners Committee conversations is Fort Collins. So I'm really excited to get up there. Hi, everyone. My name is Judith Tieku. I use she, her pronouns. I think now I've had the opportunity to meet a couple of you. Megan, I met you in Grand Junction. It was really great to meet you a couple of weeks ago. I've met some of you kind of in other spaces, but I am the regional engagement manager, and so I oversee the regional engagement specialist team. A little bit about myself. I transferred from CDPHE to BHA. I was in CDPHE for about 9 years. I was doing a lot of tobacco control work, and so very similar to substance use work. And I collaborated with a lot of chronic disease and other work, school-based health center work, and with so many other agencies and programs. I'm really, really excited to be here. This is the first of many meetings that I will be joining you on. I just wanted to come here today just to do a quick introduction of myself and just to let you know that your group is so important to our work with community engagement. And I am very committed to ensuring that we have open communication and collaborative partnership with you all. A little bit of the work that I did while I was with the tobacco program was really to help expand our grants portfolio to include a lot of community-based organizations, and most of that work included community voice, because a lot of the advantages and the progress that tobacco has made really left behind a lot of priority populations. And so I have a lot of experience of bringing in the voice of priority populations to advise policy and strategies for the work. So I'm really excited to be part of this group and to work with you all. At this time, we haven't put together an engagement plan yet. We are still in the process of doing that. But what I would say is, being on commissioners' conversations and her trip around the states, it has been very enlightening for me. I've done a lot of traveling around the state to do tobacco work, but being able to be part of commissioners' travels to really hear from community about behavioral health challenges and successes within the community has been really great for me. And I'm really looking forward to honing in on that and also working with you all on this journey. I'm really excited. I don't know how, I feel like I'm so giddy about this, but I know that you've all met the regional engagement specialists already. And so I just wanted to reiterate how lucky I feel to be working with them all. They are really great. I know that I see Brittany here. I don't know if anyone else is here, but they're all really great, and they're really great for the regions. And I'm really excited to work together with them and you all.
Thank you,
Please,
Judith.
yeah.
Anyone's questions for Judith before she hops off?
I see a chat coming.
Oh, it's just me, Judith, saying that 2 of our engagement specialists are at the Rural Health Conference today.
Yes, that was a great opportunity we got, and we worked really quickly to put together a group to go. Kelly, our deputy commissioner, is presenting today, and Brittany is also going to be there tomorrow. It's a great opportunity for them to network and meet a lot of people who work in rural health, which is a big part of our work.
Thank you so much. And any questions for Judith, or Brittany's on as well? So Judith, I understand if you have to hop. So much fun hanging out with you in Grand Junction, by the way. We had ourselves a party with the commission.
Yeah,
That
it was great.
Real fun. Yeah.
And I'm looking forward to coming to all your communities as well and meeting you all.
Well, Fort Collins is going to show up for you.
Yes,
We're
I'm
very sure
excited.
of that.
Yeah.
All right.
Well, I'm gonna hop off now. Well, thank you all so much. I'm gonna put my email in the chat. Please feel free to reach out to me. But our email is the same kind of convention. So first name, last name at state.co.us.
Thank you. And Brittany, anything to add?
No, I don't think so. We're just still learning from y'all and just excited to be here. So I'm sure we'll have more updates to come.
Thank you all.
Thanks, everyone. Have a great day. Bye.
Thank you. So, Caitlin, shall we return to updates or do we want to move to Andrea next? I don't know if you're also on a time crunch.
I am not on a time crunch, so will of the council, whatever y'all would like to do.
All right. Let's go to updates and hear from all our partners. What's going on in the prevention world?
I'm sure probably right after this meeting, I'll think of, 10 pertinent updates. They're all slipping my mind right now, but I will get back to you if I can think of anything.
Thank you, Bonnie. Anything else from prevention? All right. How about treatment? What's happening in treatment land? Now, don't everybody speak at once because we know there's a lot happening. Here we go, Jenny.
We're excited about the new Bejasos and really looking forward to learning to work with them. And I think I express most of the Southern Colorado providers' opinion that this is going to be a great collaboration. So we really look forward to it.
Thank you, Jenny. We're all so excited about the faucet and what it means for our communities to get the help they need, when they need it, where they need it. It's a new day. Anyone else? All right, how about recovery?
Hi, everybody. I just wanted to say that we just wrapped up an amazing recovery month. There were so many awesome rallies and events, and it was really, really cool. It closed out with Mobilize Recovery. There's a man who started this company or this organization, I guess you probably should call it. And he goes across the country with this big old bus that people write stuff on. And they stopped in Castle Rock and So Hard Beauty. Raquel Garcia and her crew helped with it, helped put it on. There's a word that I'm trying to find, but I can't find it. And so it was just awesome. It was just awesome. I want to say that things most definitely doubled in numbers this year. So, and I know that there's other people here from the recovery community. So I'm sure someone has something else to say about that or what's happening next in recovery.
What else we got around recovery? Recovery? So awesome. All right. And again, if you can't think of it now, like Bonnie said, please just continue to communicate all the amazing work being done via our email. And we can move on then to everyone's favorite subject, regulatory volumes. And we'll hand that over to Andrea.
Okay, it is non-sarcastically my favorite subject though, but that is because I am a total dork. I am Andrea Jones. I am the Deputy Policy Director over at Behavioral Health Administration. My director, Ryan Templeton, I believe most people on this council are familiar with, and what the policy team, as well as quality and standards, community engagement, the whole of the BHA has been out in community talking about our updates to our rule volumes. So I'm just going to do a quick framing on what that means, why it matters, particularly to this group maybe, and upcoming opportunities to weigh in. We're just getting started here. There's tons of feedback opportunities. I am always available for questions. I'll put my information in the chat at the end. So what is a rule, right? Or a regulation? Rule volumes just contain multiple regulations. Oh, okay. Sorry. I'm not going to monitor the chat. Caitlin, you let me know if I need to address something because I will distract myself horribly. So rules are a state agency's way of clarifying and interpreting statutes, the laws that are passed by the General Assembly. This allows any state agency, BHA in particular, to sort of set system standards, minimum standards and requirements for different entities, systems, players in the behavioral health space. The reason community engagement and feedback process with us and our drafted rules is so important, especially when we get to system rules, which I will talk about in just a minute, is because all our communities look so diversely different across the state, right? The network adequacy standards that work in the urban corridor aren't going to work on the western slope necessarily. We can't expect the same problems in the behavioral health system to show up in the same ways. So we're taking a really narrowly tailored, community forward approach where you'll see that some of these rule volumes are very skeletal. They still need a lot of meat on them. And that is where we need to lean into community, people with lived experience, expertise in their various fields to tell us, in my community specifically, this rule works or does not work because of something that we at the BHA may not even know about, right? That's why this is so important to be a conversational process. I think it gets misframed sometimes because it's rules and it's laws, like Megan was alluding to earlier. It's really not that scary. This is more an opportunity than it is, and nobody regulates just to regulate. I know that's a perception. Rules are really, really helpful. They're not just scary to providers or patients of behavioral health services. So to make that a little bit more clear, what am I talking about? We now have 3 rule volumes. We can do next slide, Caitlin. Perfect. All right. So those of you who may have engaged with BHA in the past or OBH previously know that we have one set, typically up to now, of regulatory volumes that sets the minimum standards for behavioral health service delivery at certain providers, right? Safety net providers, for example. This will say, here's your reporting requirements. Here's the health, safety, welfare considerations that you must take into account. Here's what happens if something goes wrong. This rule volume 502-1, that CCR is the Colorado Code of Regulations. I will drop the link to our rules page in a minute, which links to this, but you can also find any of these rule volumes on the Secretary of State website. The 502-1 is our provider rules that already exist. This is what we have been in community talking about for years now as we set up these standards. That rule volume is primarily over in our quality and standards team with our licensing managers and Tom Miller. And like I said, it already exists. This is sort of round 2, round 3. This is an iterative rule volume that will keep growing and changing with the system as those minimum standards are raised. In the behavioral health service delivery space, again, this is rules about the ways in which licensed, designated or approved providers that have that credential from someone in the state regulatory space, those rules that they have to comply with. It's pretty specific in that sense. They're very meaty, they're very technical, they're very important. So that is the rules that I think the group is largely most familiar with. System rules, and while I said these system and administrative rule volumes are new, that's a little bit of a misnomer. These rule volumes exist. They have rules in them currently about things like addiction counselor standards or the awarding of gambling addiction grants, things that we have to have rules for in order to implement them. But we are looking very strategically at which one of these 3 rule volumes any given regulation should be in on behalf of BHA. While we're doing that realignment, it may not make total sense. You'll see in the system rules in a minute that some of those things still remain intact. They have to. For now, we're going to get that alignment happening. But for now, just know that all of these are active rule volumes, have been. What's getting added into them is the new content that we'll talk about. On the provider rules, the new content, again, Tom Miller and primarily Ryan Mueller, whose information I will also put in the chat, who works for BHA, but is the State Opioid Treatment Authority, or SOTA, we call him. And most of the changes to the provider rules are in Chapter 13, and they deal with controlled substance licensing and sort of medication-assisted treatment in the substance use disorder space. Ryan is a foremost expert in this. He is taking this feedback very seriously. We've already been a number of places in the state. We're going more. If you are interested or work in that space, the provider rules are probably somewhere to look and to start engaging with that content. The system rules are new, aside from those 2 shell volumes or 2 little like standards that we have in there that just need to sort of stay there. Nothing's changing with them other than their location, because we added a new Chapter 1 into the system rules. And this is really the meat of what we're adding in. For a long time, we were referring to these as the administrative rules. You'll see that's a separate volume now. A lot of these words and what we were referring to these volumes as were driven by kind of legal jargon about how they're promulgated, which is a fancy way of saying written. And that wasn't serving us very well, because we were internally confused and therefore externally confusing people as to what these rule volumes would contain. Now we think we have these titles a lot more accurate to what they're supposed to do. So the system rules, this is how BHA is going to share its vision of the behavioral health system, the network adequacy standards, that prioritization and funding that our commissioner is allowed to sort of prioritize across state agencies in this space. Again, though, we're taking a very tailored approach with community involvement to say the continuum of care in Region 1, for example, is going to have different network adequacy standards than what exists in Region 4. That's about the baseline that we can start with. Is here's 14 safety net services. Let's look at the distribution of them across the state, what it will bear in reality now, so that we can identify those gaps. And with the help of our BASOs, our Behavioral Health Administrative Service Organizations, who are really in communities and acting as that contracting arm and in charge of those continuums adequacy, working really closely with them and their community informed councils to set those standards in a space where movement to raise the bar of the minimum standards is possible, regardless of where you live in Colorado. There's a number of different sections in this rule, these rules. I don't want to take up, chapter by chapter by chapter, because that's what our rules stakeholdering meetings are for. I'm going to give you all that information on the next slide. The administrative rules are more programmatic specific rules. Again, we're sort of moving from a programmatic, a certain dollar amount to do a certain program in a certain area, to a more systemic view of these programs. By necessity, those programs still have to operate. We have to figure out how they work cohesively in the system, not just pull them out of it. So those required system specific rules, especially in the children and youth space, if you're interested in that space, the administrative rule volume is where you might want to start looking. Okay, next slide. Yes.
Yeah, Andrea, just a couple of questions in the chat. One is, will BHA be providing a side-by-side for rule change? I'm assuming to like show what has actually changed. And
Yes.
then another one was, when are the rule changes final?
Perfect. Great questions. So we refer to that sort of side-by-side as a red line, or actually sometimes as a side-by-side, but those are available. And the way typically that it's done is very similar to legislation, where anything we're removing will appear in strike through, and anything we're adding typically appears in small capital letters, or red font. Sometimes we do that. I'm not sure we have a totally consistent typeface convention or approach across the 3 separate volumes, but the information is there for what is changing. That being said, the System Rules Chapter 1 is all new content. So we didn't want to put it in this huge kind of hard to read font. Honestly, it made it more difficult. So that's the only caveat that I would give. The provider rules and the administrative rules, I'll drop the link to the volumes in just a minute, have that red line side-by-side comparison so it should be pretty clear what we're adding, removing, and why. The other question was, okay, so we do have a timeline, which again is on hang on, let me drop this first because I think this
dropped
might.
the BHA rules and laws link into the chat already, and let them know about the upcoming meetings that they can find on there.
Excellent. Yes. So these being iterative, so there is a legal like promulgation process, right? That takes a couple of months. The provider rules already being in place, those changes to them, we're expecting, I believe, beginning of next year, like around the January 25. Also, there will be continued rulemaking as the BOSSOs come online in July of 2025. So that truly is an iterative volume where I can't really give you a start and end date to when any particular rule would be effective, because it depends also a lot on this feedback that we're getting. For example, the feedback that we've received already on the rule stakeholdering that we've done to date has caused us to extend our stakeholdering timeline and go, oh, you know what? We need to have more of these conversations. So that's good news, but also means that I can't really give a precise answer. I will say that some of them, sometimes we are told by the legislature when we have to promulgate a rule by. Those are really sort of one-off deadlines that we don't serve us very well. We try to avoid them in general, but sometimes to make a program work, it has to be done that way. And those are on whatever timeline the General Assembly so decided. The one that's in top of my brain has to do in the administrative rules from legislation this year, and I can't remember more. That I will give you Meredith's contact information for the administrative rules. So did that answer both of those questions okay?
Yes, and I know that the rules are linked in the BHA rules website that I've linked in the chat. Are the red lines available yet?
Believe so. Let me, I think so. Let me get them from Tom, and then Caitlin, could you send an email to this group for me with the red lines in them? When
I'll include the red lines in the follow-up email, everybody. So just look for that in the follow-up email.
Yep.
Thank you. And also, Andrea, will you just let this group know when when the state board are hearing those rules, so that we can also just continue to educate ourselves and participate appropriately in that portion of the process.
Absolutely. That's a very good point. And just to be clear, that's an interesting nuance. The provider rules go through State Board of Human Services pursuant to their schedule. The system rules and the administrative rules are actually commissioner promulgated, which just means that she's the hearing authority for who would promulgate the rules, as opposed to a board of people under the same authorities. However, that hearing and that promulgation process is subject to that same robust stakeholdering notice, public hearing requirements that board is. So all of those legal notices will come out. In addition to that, I will ensure that this council has notices of all of the hearings, whether they're at board for provider rules or with the commissioner for system or administrative rules starting next year.
Thank you.
Yep. And if we go to that slide, yep. And Caitlin will send this a PDF of these 3 slides out to you. And I believe the links work, I hope. You will see at the bottom, here's our schedule. I know some of this has already passed, but just demonstrative of where we're trying to be in the state. The websites at the bottom, the feedback form is a Google form that will allow you to make written comments on any of these rule volumes. If that is a preferred method for feedback, it ensures that we have it. It's part of the rulemaking packet that will get shown to board and commissioner. It's a really great way for us to keep track of feedback. It's not the only format by which you can submit feedback, of course, but it is a very effective one. So we try to push use of that form a lot. We have a lot of eyes on it. So that's helpful. And I think, yes, the email address is right underneath the form if you'd prefer to just send an email or show up at any of our meetings and talk live.
Thank you, Andrea. And will you share this slide deck with the group as well?
Absolutely.
I'm asking all the questions.
I
Opening
love
it
it.
up to the group. Whom else has questions regarding this wonderful opportunity to participate in the rulemaking process with the Behavioral Health Administration? Annette.
Who would this be? Like, I would love to encourage other people outside of this group to join us at these meetings. So, like, who do you suggest that I share this with?
Honestly, anyone and everyone in community that is like specific to the areas in which that's the feedback we're really seeking. That being said, truly anyone, this affects every person in the state of Colorado that does or will receive behavioral health services. So from that lens, anyone who's interested, I would say people working in or very enmeshed in the behavioral health space in their communities would be prime audience for this.
Okay, thank you.
All right. How about who do we ask if we have questions? What if we're like, I don't know what promulgate means, or other things that can sound mysterious in rule. Who is the human being that we would be asking?
I would prefer to be your preferred human being for this council for rule questions. I put my email in the chat. Granted, I am not, for example, the right person for provider rules, but I can facilitate that connection for this group. So I will be your point of contact for most rule things, and definitely for system rule things. And then I will facilitate anywhere else you need to be to get answers.
Fantastic, thank you. Any other questions for Andrea? And we see the feedback form is in the chat there. I also did drop in the Secretary of State. Just it feels a little more confusing on that website than it does on BHA. So thanks for making it less confusing on your website. And we look for that side by side. there's no more questions for Andrea, we're just a little ahead of schedule, which is awesome. And I'd love to just go ahead and open it up for public comment and just give a bit more time for the public to come into this space for questions, concerns, statements. So open for the public comment. I see a hand, Dennis. And if I don't see your hand, please just come off mute because I can't really see everyone on the screen. Dennis.
Dennis has his hand raised.
Hi again. Again, welcome to our new members. And I'd just like to share a little bit about the process of what we went through in reviewing applications and picking new members and how that can help BPAC going forward. Megan was a big part of that, as well was Hope Hyatt, Caitlin, Ryan Templeton. We were looking at expanding the diversity of our council. And by diversity, I mean a broader look at the behavioral health issues and how it impacts the different communities. So our new members represent a pretty diverse group of potential wonderful information for us. Part of what we need to do is we need to learn about the other issues that we're not experts on. So we need to design a vehicle to educate each other about issues so that we can be more effective into the community where we are their real advocates. So again, I'm encouraging our new members to get involved in the bylaws creation that we're going to redo, and everybody that is already a member, get involved. And we do need to share our different information about our expertise to help us all learn about the different issues. So thanks again for joining us.
Thank you, Dennis. And I see Tosh has a hand up.
So this question is for Andrea. My question is, when it comes to rules and when you're reading it in off the Secretary of State website, and on some rules it'll say effective July 1st, 2025. What are the current rules still in place, and where can we find the current rules? Because I've noticed on some things there are not, the new rules like are posted, but it says effective, but the old rules, I can't find them.
That is a very good point. So, and this is one of the harder differentiations. The rules, all 3 volumes that I showed you, are in effect right now. The ones that are in them are currently in full force and effect, and we are auditing to them. And those are the ones, if you click the link on the Secretary of State website, those are the ones that are currently in effect. Any of our rules on like our website are those drafts, those things that we're changing in small caps that have a different effective date, are just for that specific rule. But the volume itself remains in effect on those effective dates on the Secretary of State. Does that make sense?
Yes, that makes total sense. Thank you.
And I see Danielle House has a hand up.
Hi, I just have one comment, and it's going back to the list of the grants. I think it was 78 in total. I'm not sure where those come from. Does that come from the federal government? Because I noticed there's only one for tribal, and we have 2 tribes in the state of Colorado. So I feel like they're gonna have to fight for that, right? And I noticed that Ignacio always gets the behavioral health things, I'm pretty sure, because I know for a fact I live on the Ute Mountain Reservation. Our behavioral health is really, really bad. We don't even have anybody to speak to on our reservation. We have to have a doctor come in from Denver to see my son who's on the spectrum. And it's really sad. So I feel like, why isn't there more opportunities for a tribe? Why isn't there 2 for each tribe? Why do we have to fight for it? And that's my only comment.
That is a very interesting point. I believe these are all federal grants. What I am not sure of is whether or not the historical awarding of that to just one interest is like required, or if it is truly one grant, or if you can use the money in different ways. That's where that probably technical assistance comes in. Caitlin and I can kind of chase that down a little bit on our end. That's a really interesting point. Thank you
Yeah,
for
thank
bringing
you
that
for
up.
bringing that up, Danielle. I also linked Tracy Pohl, our SAMHSA regional director's email back in the chat. I think that that would be a great conversation that we can bring up with her. And do you happen to know anything around that grant specifically?
I don't.
Okay. Okay.
But I
definitely-
do know that a lot of our tribal members have to reach out to Ignacio for assistance sometimes. A lot of our tribal members have to leave the reservation and go to Denver to get adequate care. So that's just one issue that I know on our reservation that we struggle with. So thank you for listening.
Yeah, thank you for bringing that up, Danielle. That's an incredibly valid point. And yeah, I think I will reach out to Tracy Pohl again with that, and I'll just CC you in that email if that works.
Perfect, thanks.
Thank you.
Thank you for raising that, Danielle. That's exactly why this council exists, right? You know, and it is part of why we're doing this work statutorily. Make sure that these federal dollars are getting to the places they need to get to, and the humans that need them, and the providers that need them. So just a wonderful example of how adding these voices to this space is already affecting positive change. And so I know Tracy will have some answers for you, and something for the whole group to think about as we do think about moving into next year and how we are informing this process to make sure those dollars are reaching all the peoples. Any last public comment? Public comment. The public is very important. These are open meetings. Want to make sure our public has the chance to speak into this space. Okay, hearing none. We are just at about time. So let's go ahead and look for that motion to adjourn. A fancy way of saying we're going to end the meeting. So I need a motion to adjourn.
Motion to adjourn.
Thank you, Kelly. In a second.
I'll second. This is Annette.
That closes out our meeting for today. If someone felt like they didn't get their question in or voice heard, please know we are available to you. So welcome again to all our new members. We're going to change the world.
Yes, and I'll be sending that follow-up email either by tomorrow or Monday with all the information that we discussed, the slide deck, some links. So just be sure to keep an eye out on that because some more information will be coming to you. All right. Thank you so much, everybody. Thank you. Have a great rest of your week. We'll talk to you soon. Bye-bye. Thank you.